Welcome to Policy on Demand. I'm Sindhu Blume. Even before a new administration comes in, the work to fill out the cabinet begins, as do policies the new president promised over the course of the campaign. We're going to look into those policies for President-elect Trump, starting with healthcare. So, how will the second Trump administration explore potential health policy changes, anticipated actions within the first 100 days, and what we can expect in 2025? Joining me to talk about just that is Kelly Griffin, PwC's Health Policy and Intelligence Institute's leader. Kelly, welcome.
Thanks. Happy to be here.
So let's start out with what the priorities are going to be for this administration. And out of curiosity, I want to know, we had the Affordable Care Act, which then at the time, President Trump wanted to repeal and replace. So where does that stand in this new administration?
It's a great place to start. So when we're thinking about what's going on here in 2024, as well as 2025 and the years to come, for health policy specifically, we really want to keep in mind that this is no longer 2016. The debate in healthcare is not about, are we going to repeal and replace ACA? We no longer quite have the same level of political or public support for such sweeping reform. In fact, we actually see something a little bit different. We see Trump taking credit for saying he saved the ACA. What that tells us is while there's not political support for sweeping reform like ACA repeal replace, there's a lot of attention that's going to be focused more on tweaking the ACA and the marketplace. It's going to be these tweaks that focus on deregulation, market stabilization, budget focused, but less sweeping changes like we were talking about in 2016.
Okay, and then other priorities that are on the horizon for the Trump administration?
Sure. We're thinking about the Trump campaign and what the Trump administration might be focusing on. I like to put it into three key themes. So we have flexibility and choice for both states and individuals is the first. The second being accessibility to care. And the third, thinking about deregulation. Okay. Focusing on the first, thinking about the flexibility for individuals and states. We're looking at shifts to the ACA, for example, potentially introducing risk pools. J.D. Vance was rather vocal on that, so separating individuals according to their risk level. Potentially opening up the door for policies and plans such as short-term duration health plans. These are ones that have far less restrictions than typical ACA plans. It's likely the Trump administration is going to open up the door there and make them a little bit more available and expand their ability to be implemented there. When you're thinking Medicare, the Trump campaign was very specific that he's not looking to cut Medicare. He's also not looking to change the eligibility age for Medicare. Very clear on that. What he might do with Medicare is he might be a little bit more aggressive with IRA negotiations for the drug prices. In reverse, when you're thinking about Medicaid, Trump was very unclear as what he's looking to do with Medicaid. And that's opened up a lot of conversations, the possibility there might be some spending cuts to Medicaid. We might see some shifts there. Potentially looking at work requirements would be very likely to be introduced, as well as thinking about block grants.
Okay.
So for Medicaid, when you do block grants, currently the federal government provides states a percentage of how much they're spending for Medicaid. Block grants would shift that to a stable amount of funding, and then it would be up to states to decide how they're going to spend that funding, regardless of the number of beneficiaries or other circumstances, and how those change over the years.
Let's switch over to the first 100 days. We, every 4 years, we're focused on, all right, what is this president going to do in the first 100 days? So what are you hearing about that and expecting?
So the first 100 days is likely to be focused on these big ticket topics we keep hearing about, things like inflation, the economy, tariffs, Gaza, Ukraine, right? These are the big topics. Immigration is going to come up. What the health sector should be thinking about is how do health policy really intersect with those big ticket topics.
Okay.
Right? And the way we're going to likely see them intersect is, for example, we'll likely see executive orders, even in the first couple of days, that start repealing Biden-era policies. The executive order on AI is going to hit the health sector. They're going to have to keep on top of that.
Right.
Thinking about any Biden-related policies related to diversity, health equity, climate, gender, All these things are certainly going to shift rather quickly. On top of that, the health sectors want to keep an eye around February 1st. That's when the second round of the IRA negotiations, that list is going to come out February 1st. It's a very opportune time for Trump to be very outspoken and be a little bit more clear and aggressive as how he's going to address drug prices.
Okay, and in all of this, what is the role that Congress plays in terms of political priorities and legislative priorities?
Sure. Congress is, of course, going to play a rather large role. While the Trump campaign focused a lot of the rhetoric throughout the campaign on executive actions and what type of activities he would likely do through the executive branch, Congress is certainly going to be a partner as we're thinking some of these bigger picture policies. The focus over 2025, likely to continue to stay focused on the Tax Cuts and Jobs Act. For the health sector, that connected to that is the ACA subsidies. So ACA subsidies are currently set to expire at the end of 2025.
Okay.
And so part of the negotiations throughout 2025 is going to be identifying, are the Democrats able to retain and renew those subsidies, maybe even make them permanent? Or are the subsidies themselves going to expire?
Okay.
On top of that, there's a number of bipartisan health topics that are likely to come through Congress. We'll likely see movement on. The Biosecure Act has a lot of attention. Thinking about PBM reform, there's a lot of attention there. Thinking about site-neutral payments very much might come up. That's a pay-for. So when you're talking about the Tax Cuts and Jobs Act, policies like site-neutral payments are a good opportunity to go ahead and recover some of those budget impacts of other policies they're looking to renew.
All right, so let's look ahead to 2025. What are the major debates and headlines? And I'm curious, from now until January 20th, how do you think your conversations with companies are going to go? Do you see a theme already that companies are bringing up?
Sure. So the Tax Cuts and Jobs Act certainly is going to control the conversation and it'll dictate the narrative throughout the year. That said, there's certainly going to be a good number of debates to keep an eye on. I'm interested to see how the state level trifectas are going to intersect with the federal level. So we have far more state level Democratic trifectas this time around than we did in 2016. And they're going to have a number of health policy plans, priorities, actions they're able to take at the state level, and how that intersects at the federal level will be awfully interesting. And there are a number of court cases that are already existing in the system that currently the Biden administration is involved in, but when Trump takes office, it'll be the Trump administration. What will be interesting to see is the extent to which the Trump administration continues to take those cases with the same defense, or if they shift their approach a bit. We'll keep an eye on that. And the last thing I'll flag here, and what we're keeping an eye on, is how Chevron deference plays out, both for those existing court cases, but also for any types of new rules that might come through in the next year or two. Of course, we know Chevron deference shifted the balance of power between agency as courts. Now that we have a more conservative administration, that's going to flip things to an extent. And it's also introducing this idea of a range of reasonableness as well as the best interpretation.
Okay.
Both of those are going to really shift the conversation, and it's interesting to see how that plays out.
All right, Kelly, this has been really great. I think there's a lot forthcoming in healthcare, and I'll be really interested, and I think our viewers will be interested in seeing how things play out, especially in the first 100 days.
Well, this is great. I'd be happy to come back for more conversations.
Thank you. In the description of this episode, you'll find more information about the health industry insights from the Health Policy and Intelligence Institute. This episode is the first in a series looking at different policy initiatives under the second Trump administration, so there's a lot more to come. We appreciate you spending this time with us. Take care.